This is talking about those natriuretic peptides. They're doing the opposite. They are caused when those baroreceptors and osmoreceptors are recognizing that we actually have an increase in fluid volume. They're going to do the opposite. So they're going to decrease reabsorption of fluid and promote urinary excretion of sodium. So when you get those BNP, there's buildups of these NP, these natriuretic peptides, it's going to do the opposite to the kidney, right? It's gonna stop the kidney or slow down that reabsorption of fluids and sodium. Instead, we're gonna increase that urinary excretion of water and sodium. And again, sodium follows water. And so what does that do? Well, if you have less fluid in your body, it's going to pull that fluid out of your intravascular space, interstitial space, and it's going to lower obviously your fluid volume. I wouldn't go crazy looking at all of this. Just understand what I just said and you're good to go. What's triggering it and what does it do?